Good morning, everybody. We are so excited today that we're having Laura Stryker, who is with the Florida Department of Health, come in and do a safe sleep presentation for us. We did receive a few questions that I've already mentioned to Laura that she's going to answer, and thank you so much for everybody who sent those in. So without further ado, I'm going to let Laura take it away and get started. Welcome, Laura.
Good morning, everyone. Thank you for joining us today. We just wanted to go over some do's about safe sleep, and we're going to discuss the recommendations according to the American Academy of Pediatrics. Reason being, over 3,500 infants die a year related to infant deaths. So we're going to discuss how to set up a pack and play, and also how your infant should sleep, whether you're using a standard crib or a pack and play. First, we're going to show you how to set this pack and play. You're going to take it out of the carrying bag. And then you're going to un-velcro the sides, which this also duplicates as the mattress. You're always going to want to use the mattress that comes with the pack and play and the crib. So we got the mattress, and you're going to want to open up the sides. First, you have to have it the right way. There's the bassinet. You're going to open up the sides and lock the two sides. So you lock these sides, see the buttons right here? And then you lock the other two sides like that. And then once these are all locked and safely together, you're going to push down the middle. And there's that. Remember, they always recommend that you room share, but not bed share. Here's the mattress. There's buttons on the back, and there's holes in the inside. So we're going to want to make sure that we button the mattress. And this is for the standard position. See, the holes here. And you button each side like that to make sure the mattress is safely positioned. We'll go ahead and show you all of them. And another thing is, each pack and play has different weight restrictions, whether you're using the standard crib or the bassinets. You want to make sure you look into the manuals to see which your particular pack and play has. So there is the approved mattress in the safety position. You want to make sure that you use a fitted sheet. This is for pack and play, but also the fitted sheet for a crib. And you're going to want nothing in the pack and play. So I'm going to show you now how to set up the bassinet in the pack and play. Just take the mattress out. And you get the bassinet feature. Now, some pack and plays do not come with the bassinet feature. And like I said before, you want to make sure that you follow the recommendations. Each device has a manual, and then it also will let you sign up for any recalls related to the item. So each side has plastic that you're going to snugly put on each side. And as you can see here, we have this pack and play set up. It's not around any walls, cords. You're going to do the same thing with a standard crib. And then you're gonna place these bars together. There's the bassinet. So we're gonna get our mattress back. This time we'll put the crib sheet on. And you're gonna make sure that it's tightly fitted. And then you gently place it back into then also some features come with the mobile. Just put the sides in there. And then you place it on the side.
More plastic. There we go.
Now, if your infant is reaching up, that's okay, but you probably wouldn't want to have them sleep with this on there. So now, getting your infant ready for nap time or bedtime, you're going to want to make sure that they're appropriately dressed. You don't want to overdress them. If you're comfortable, then they're comfortable. You can use a wearable blanket or a sleep sack. This one's made by Halo. So you're going to unbuckle the sides. Gently place your infant inside the sleep sack. And these also have recommendations. This one goes up to 3 months of age, but you're going to want to check the particular manufacturer's recommendations. It's okay, baby. We're getting you dressed for night-night time. So you zipper that nicely, and then you're going to want to make sure that you have it secured. The Velcro. So now we're going to talk about the safe sleep position. Like this says, back is best. So whether you're using the pack and play, you gently place them in there. No items are visible. Previously, there were other recommendations of how safe sleep, whether you hear from family members or friends. The American Academy of Pediatrics recommends this position. And then also the same thing is true with a standard crib. You're going to place them on their backs. No items in the crib. And then they wake up very happy and rested. You want to make sure that nobody is smoking around the baby, whether they're in their sleep situation. It's recommended to breastfeed. You can use a pacifier, but they want you to establish breastfeeding before starting a pacifier. And then also, it's recommended that you share with loved ones. This is just a little cheat sheet of how you want your baby to sleep. That back is best. We can share this with you if you need it. And also, now we're going to show, you want to make sure they get plenty of tummy time when they're awake, and that helps aid proper development. So we're going to take off the sleep sack. And then you're going to want to place for tummy time on their stomach on a hard surface. And that is pretty much the basics of safe sleep. So now I'm going to show you how to close the pack and play. First, we're going to take off the mattress. Take off the fitted sheet. And also you can check on any recalls on the US Safety Commission website. So there's the mattress. We're gonna take off the bassinet while we're loosening. The sides. You're gonna pull the center, and then the little buttons on the side, you're gonna press them. They won't come undone until you pull up the middle. Sometimes they like to give you a hard time. There you go. And then you're gonna place the packing plate back inside the mattress. Put the bassinet in the middle here. And they have nice little velcros that keep it tight. And then it has a handle there, so you want to make sure to pack it. Carrying case. These are nice because you can bring them to family and friends' house and ensure that they're able to safe sleep by themselves. And like I said, they can be in another family member's room, but not in your bed. Once again, I want to thank you for joining us today, and I hope you learned a little bit about safe sleep. Have a great day.
Thank you so much, Laura, for sharing all that great information with us. And so can I ask you one more quick question?
Sure.
So how do you deal with family members? We get this a lot from women. How do you deal with family members who think their way that they did it in the past was better than what the American Academy of Pediatrics is recommending right now?
Well, it's like I said, reinforcing that this is your preferred method, you know, setting boundaries with the family members, and advising them this is your preferred way as a parent, and hopefully they will buy in on, you know, kind of supporting your decision.
Okay. And then one last thing. So is it best for women to bring the baby home and put them in a pack and play, a bassinet, or a crib, or does that really matter? As long as
it's whatever the family feels, and everybody's different, you know, where they feel most comfortable in. They recommend room sharing up to a year, and either a pack and play bassinet or even the crib, if that's where you would like to, you know, have your infant sleep.
Great. Well, thank you so much again for sharing all this great information with us. We really, really appreciate it. We know you're a busy
And then also,
woman.
oh, and if each, you know, mother or family has any other questions regarding to their individual infant, it's important that they kind of consult with their pediatrician.
Okay, great. Thank you so much. Have a good day.
Thank you. Bye-bye.